احنا last time وصلنا لهون تقريبا ال pathways for transmission of sensory information. احنا راح تلاحظوا في شغلات بجوز ماخذينها بالاناتومي وبالفيزيولوجي. كويس، احنا نكمل بعضنا البعض، ما فيها حاجة. طيب. If there is no question, last time we said we have two major pathways for sensory information. One pathway we called it the dorsal column medial lemniscal system. Dorsal column أو posterior column هو posterior column بالspinal cord. The other system is called anterior lateral هون spinothalamic system. It is spinothalamic and it is located in the lateral and anterior column of the spinal cord. Spinothalamic system. طيب نشوف these systems how their pathway and what are the kind of information they transmit. This is the system dorsal column medial lemniscal system. What type of sensation it transmits? It transmits fine touch. شوف مش بس fine. لما نحكي هون fine we mean well localized. So fine here well localized. يعني لما تنغز بغز touch very small point بتحددها exactly you localize it exactly where is. لما نقول crude touch poorly localized. يعني لما تنغز مثلا على ظهر ايدك بتقول كأنه الإيد كلها فيها كأنه إحساس، يعني it is poorly localized. But this is fine touch, fine pressure, fine vibration, stereognosis. حكينا stereognosis المرة الثانية بجوز last time. Stereognosis معناته إنك لما تلمس الشيء بإيدك when you touch it by touching you know its form and texture. يعني ملمسه وايش شكله مربع مدور وملمسه ناعم مش ملمسه. And this enters from the receptors, enters through the afferent neuron, that it ascends through the dorsal column. Where does it go? Here we have two parts of the dorsal column. We have one part called gracilis, fasciculus gracilis, and the other part is called fasciculus cuneatus. Fasciculus gracilis is the medial one, and the lateral one is fasciculus cuneatus. Okay, this kind of tract is really has very good organization or fidelity, what we call it, fidelity or organization of this is somatotropic. Exactly. هلا fasciculus gracilis presents the information from the lower half of the body. And gracilis brings the information from cuneatus brings the information from the upper half. Or otherwise they transmit the same kind of information. Upper half of the body. Otherwise the same sensation they transmit. هاي مثلا هون الكينياتس transmits fine touch, fine pressure, vibration, proprioception كلياته بس from the upper limb and upper trunk, here from the lower limb and lower trunk. Then they go to their corresponding nucleus in the medulla oblongata. And in the medulla oblongata they synapse in their يعني gracilis it synapses in the gracilis nucleus, and cuneatus it synapses in the cuneatus nucleus. Then after they synapse they cross to the other side and they ascend as the medial lemniscus. Okay, then from there they go to the thalamus. Where in the thalamus? They go in the thalamus into ventrobasal complex. basal complex. And the ventrobasal complex of the thalamus consists of two parts. VPL, ventroposterolateral, and VPM, ventroposteromedian, nuclei of the thalamus. And from there they go to the primary somatosensory area, chromatosensory area in the cortex. Okay, so this is their transmission. Let's talk here the same thing from the receptors. They go ascending branches. There they go the dorsal column nuclei here, gracilis cuneatus. جراسيلس بسموها بالعربي النحيلية الوحيلية يس، وكونياتا سموها وتدية. And from there they cross, they ascend as the medial lemniscus حكينا, they go to the ventrobasal complex of the thalamus, and then they go to the cerebral cortex. Where in the cerebral cortex? شوفوا الcerebral cortex. High cerebral cortex, this is the cerebral cortex هيك. cerebral cortex في إشي اسمه سالكس جروف، يعني لو اجينا لهيك this is sorry هون نمسح. هاي cerebral cortex, this is sulcus. This is another sulcus groove. And this is sulcus. Now the area between these two sulci, جمع sulcus, is called gyrus. So a gyrus is an area between two sulci. Okay. Now here in the cerebral cortex, this is the lateral view of the cerebral cortex. This is anterior. This is superior. Posterior. And this is inferior. And this is, there is a main sulcus called central sulcus here. And there is another sulcus called lateral sulcus. So these are the two sulci, main sulci. This is central. And this is called lateral sulcus. This area behind the central sulcus here this area behind the central sulcus here is called post-central gyrus. Post central يعني posterior to the central. gyrus. The area anterior to the central sulcus here is called precentral gyrus. Now this post-central gyrus area is the primary sensory area. Then this is the primary sensory area. Somatic sensory, of course. Sensory area. شوف نحفظها أسهل شيء. بوست فيها اس سنسوري، بري فيها ار موتور، ماشي هيك. طيب هلا نيجي نرجع لهم هون. اذا dorsal column contains large myelinated fibers اللي هو A beta fibers. speed, a high degree of spatial orientation. حكينا انه لما يمشي اللي بيمشي من تحت من اللور بيمشي على الميديال، اللي وراه بيمشي هون جنبه، بعدين بيمشي جنبه. هذا اللي بنقول high level or high spatial orientation or high spatial fidelity إخلاص. تقول هذا الشخص مخلص، he is fidel. Throughout the tract transmit information rapidly لأنه through A beta with high degree of spatial and temporal time, spatial space. إذن fidelity in terms of time يعني طوالي ما بتأخر، و spatial in terms of place. أو faithfulness. This is what's fidelity. Mechanoreceptive information. كل هدول information they are mechanoreceptive. Fine touch, fine pressure, vibration, position, proprioception, fine pressure. Stereognosis. Stereognosis it depends on touch. إذن هي كمان mechanoreceptor. Stereognosis. حكينا stereognosis to know things by touching them, forms or texture. طيب. This is a pathway here. Where does it go? حكينا it goes to the post-primary somatosensory area, the post-central gyrus, here. It is in the post-central gyrus area. This is the primary sensory area. Here the cerebral cortex. The cerebral cortex is divided into lobes by the central sulcus and lateral fissure or lateral sulcus. Lobes that these lobes they divide into frontal lobe anteriorly, frontal lobe, parietal lobe جانبي, occipital lobe قذالي, and temporal lobe الصدغي. And these are the lobes. Okay? هلا هون بالبوست central, here is the post central area. The post central area is here. بجوز الاناتوميست بيحبوا يسموها برودمان كلاسيفيكيشن، يقول لك area 6 او area 3 مثلا او area 4. areas بسموهم باسمائهم. احنا ما بنحب نسمي الاسماء لانه these are histological classification. But this area is the main sensory area. And this area, if you remember from the very first year كنا بنحكي, we have representation on this area. Our body is represented on this area. And the representation on this area of the cerebral cortex is upside down, مقلوبة. إذن this upside down. هاي واحد. هاي اثنين. الشيء الثاني the area that represents any part of our body is not proportional to the size of the part. يعني مش الايد كبيره لا، ولا الوجه ولا شوف اللور لمب قديش كبيره، كل اللور لمب يا دوب قد الايد. تفرج اللبس قديش ما شاء الله، اللبس الفيس قديش representation. It is less proportional. اذا ايش upside down and any area in the cerebral cortex that represent any part of our body is proportional to the density of the receptor, to the density and number of receptor in that area. So they are proportional to the number of receptor in that part. And sensory impulses received from that part, of course. Then this is the representation. Go back here. This is the representation. هذا من هون في كتابكم كيف الثاي والثوركس والشولدر والدق. هون a representation of the hand and finger is too much area. This is called somatos area number 1, which is here exact representation. Exact representation. As you see the areas is big. هذا اللاترال وبيجي تحت جوا هون اللور لمب على الميديال. في area جنبيها is just around it here. It's called somatosensory area number 2. This is not exact. Not exact area. Crude area. Representation not exact. As the first number 1. Okay? طيب. This is the representation as you see here. This is the hand, big area, face, lips. This is the somatic cortex. كمان هون بفرجونوها بالarea here. This is the area of the arm. شوف الarea of the arm قديش. شوف الarea of the leg, lower limb قديش. Compared to the area of the hand. ليش؟ لأنه here in the hand it has a very high number of receptors in small area. عشان هيك لما كنا نحكي هناك في السنة الأولى مثلا لما حكينا 2 points discrimination، فرضا إنه هون هاي 2 points وفي 2 stimuli، هدول they will hit 2 receptors and you feel them as 2 points. So 2 points discrimination is very good in the fingertips أو باللبس. 2 points discrimination. فالfingertips لو اجيت على المسافة بينهم كانت 2 ملم بتفرقهم as 2 points. Why? Because they hit 2 receptors. They stimulate 2 receptors. اطلع هون على الرجل، هون بدك مسافة بين هون وهون 5 centimeter to discriminate them as 2 points. Okay? So this is the difference between these 2 areas. هلا the areas that represent any part كيف نعرفهم, how we know them is coming from which nerve. These are called dermatomes. شو dermatomes? الdermatomes احنا حكينا in the beginning maybe. الامبرايو كان تيوب. هاي الامبرايو مقسم الى ايش؟ الى segments. This tube is divided into segments. وهاي السيجمنتس لو اجينا على السباينال كورد كمان، لما نيجي على السباينال كورد بنحكيها. لما نيجي على السباينال كورد في 8 cervical، في 12 thoracic، في 5 lumbar، في 5 sacral، وفي 1 coccygeal. From each one we have a pair of, from each segment we have a pair of spinal nerves. they supply areas of skin here. For these areas of skin here from C1 to C8 supplied by cervical, these areas supplied by thoracic, these areas supplied by lumbar, and so on. So if you have, say, a disease or a pain from here, you know this is coming from L3. From here, it's coming from L5. From up here, S1, and so on, okay? And L5, S1. This is the areas we call it dermatomes. Yani if there is information, if there is a pain coming from here around the umbilicus, say here, pain coming from here, pain, most probably this pain is coming from T2 and T10. If this pain is coming from this area of the leg and this area of the leg here, this pain is coming from L5 and so on. By this you can know the discs. The other system, حكينا عن السيستم الأولاني. The other system is the anterior lateral system. The anterior lateral system, unlike the dorsal column system, it consists of smaller myelinated اللي هي A delta fiber and C fiber, unmyelinated fiber. Thus the speed of transmission is very small, slow, between 0.5 and 40 meters per second. They have lower degree of spatial and temporal orientation or fidelity or faithfulness. Lower. ليش? Why? Because it goes slower, and the other things, this pathway has a lot of divergence here. A lot of divergence when it goes. إذا ما في هناك، لا هناك that system الدورسال column بيمشي one way. هذا بيعمل شوية divergence, so it goes too many ways. So that's why low level. It transmits broad spectrum modalities. مش بس هذاك بس ميكانو ريسبتيف فاين تاتش فاين كله ميكانو ريسبتيف. هون لا it transmits pain and temperature. This is pain is called nociceptive and thermal is called thermal receptors. Besides that, it transmits mechanoreceptive, but the mechanoreceptive is not fine, it's crude touch, crude pressure, بس ما في vibration, no vibration. لأنه الفايبريشن بتعتمد على إيش؟ بتعتمد على rapidly adapting, no vibration, no stereognosis, no stereo. ليش الستيريوغنوز تعتمد على الفاين touch, fine pressure. إذن في عنده mechanoreceptive tickle and sexual sensation. Besides that, we have pain and temperature. Let's see its pathway. It's coming from the receptors, of course. Here receptors. It enters the spinal cord, synapses in the dorsal horn, then it crosses the midline to the other way. So the first neuron synapses with the second neuron at the spinal cord, and it crosses to the other side. So the crossing is in the spinal cord and it goes to the thalamus. The same thing, ventrobasal complex, and there's another one intralaminar, especially for pain. Then it goes to the post-central gyrus, primary post-central gyrus area in the cerebral cortex. This is the pathway for the anterior lateral spinothalamic pathway. Here it is. The type of sensation, حكينا pain, cold or warm, temperature. Besides this, we have crude touch, crude pressure, tickle, itching, and sexual sensation. It enters from the receptors, the spinal cord. It synapses at the posterior horn and crosses the midline anterior to the central canal. Then it goes up through either lateral or anterior. That's what's called anterior lateral spinothalamic pathway. It goes to the thalamus, the ventrobasal complex. Then it goes to the primary somatosensory cortex. So it conveys impulses that are poorly localized: crude touch, crude pressure, pain, cold and warmth, itching, and sexual sensation from limbs, trunks, and neck. Okay? As a comparison between these two tracks, dorsal column is well localized. The anterior lateral is poorly localized. Okay, dorsal column has better, good temporal and spatial faithfulness, or fidelity, or orientation, whatever you like. Why? Because it has very high speed of transmission compared to low speed of transmission to the lateral spinothalamic pathway. Dorsal column has better intensities gradation. يعني شو الانتنسيتي؟ intensity مثلا like the grades. احنا الجريدز ممكن نقسمها بين 0 و 100. يعني عندنا 100 علامة، وممكن نسويها أحرف، نسويها F D minus D D plus، مش هيك؟ يعني تقريبا 12 grades. يعني هناك اللاترال سيستم بقسمها as if it is a lettering system، lettering. بس هون الدورسال column بقسمها as absolute marks. So the dorsal column has better intensity grades, more grades, less than 20 grades for the anterior lateral. هلا repetitive stimuli حكينا الفايبريشن ما بتمر في ال anterior lateral. Vibration only in on the dorsal column. Anterior lateral tracts transmits broad spectrum. It's not just mechanoreceptive. في عنده mechanoreceptive اللي هي crude touch, crude pressure. But besides that, شو عنده؟ pain and temperature. Pain, we call it nociceptive. Nociception. Now from the head, face and nasal, and from the face, nasal cavity, oral cavity, teeth, they don't go through the other tracks, the dorsal column. They go through one track called trigeminothalamic pathway, and trigemino is the cranial nerve number 5. Cranial nerve number 5 is called trigeminal tract, trigeminal nerve. So from there is a trigeminothalamic pathway. They go through the trigeminal nerve, cranial nerve number 5, and they transmit both dorsal column and anterior lateral، يعني transmit fine touch fine pressure acute touch pain temperature كلياته. So the receptors for touch pressure vibration كله stereo hypnosis from where? From the face nasal cavity, and they transmit through the trigeminothalamic pathway. So the trigeminothalamic pathway transmits impulses for most somatic sensations from face, nasal cavity, oral cavity, and teeth to the cerebral, synonymous to both system, anterior lateral and then anterior lateral and dorsal column. Both pathways. في أي سؤال؟ إذا في أي سؤال just please give me a hint that you want to ask. This is the two pathways. This is the posterior or dorsal column, and this is the anterior lateral spinothalamic pathway. You have to pay attention where they cross. شوف the dorsal column medial lemniscal pathway, they cross in the medulla oblongata. They cross. So if there is damage here in one side, say this is the left side is damaged, the loss of sensation is ipsilateral, same side. If the crossing is above the medulla here, the loss is contralateral, opposite side. Here is different. If the loss is in the here, the loss is contralateral, even from the spinal cord, because the crossing is in the spinal cord. And if the crossing, if it's also here in the medulla, it is contralateral too. Okay? Just ipsilateral is in the receptors, in the neuron only. Somatic sensory cortex, this is in the postcentral gyrus, we talked about it. The somatosensory cortex is highly spatially organized. Each receives information from the opposite side of the body, you know that. لأنه بيصير crossing سواء crossing here. Here the crossing is in the medulla. So the cerebral cortex on the left side receives the information from the right. And the cerebral cortex on the left here, on the right, receive the information from the left. So if there is damage here, whatever there is damage, or here, there is loss of sensation contralateral. Unequal representation, we said unequal. Why? Because it is proportional to the number of receptors. Lips have greatest areas of representation, followed by face and thumbs. Trunk and lower limb have least areas of representation. Now the area, the cerebral cortex has 6 areas histological, from outside inside. Area 1 and 2, diffuse lower limb, lower input. Area 4 is the all afferents, they come to area 4. Area 5 and 6 is efferents. Area 4 afferents. And these are histological classification. Don't worry about them. ولا تهتم بيهم, okay? We're not going to ask you about it. Then we have 6 separate areas from outside inside, area 1 to area 6. Incoming signal, they go to area 4. Area 1 and 2 receive diffuse inputs from lower brain centers. 2 and 3 send the neuron closely. They are communicating between each other. And area 5 and 6, they are efferent fibers. Efferent fibers. Within layers, the cerebral cortex are arranged into columns. كل column هيك عواميد الareas هذول اللي شفناهم, and every column is confined to certain sensory modality. Don't even also bother yourself about them. Different columns intersperse, interaction columns occurs. If there is destruction of somatic area 1 اللي هي post-central gyrus, what happens? There is, of course, loss of discrete localization. You are unable to localize the information, inability to judge the degree of pressure, inability to determine weight of the object, because the dorsal column has weight dorsal column has 2 points discrimination and fine touch حكينا. Stereognosis and weight discrimination. If you lose this area, you will be unable to determine between different weights. مو مقصود weight discrimination انك تحط بايدك تقول هذا جرام وهذا 5 جرام، لا، تقول على الاقل انه this is heavier than this and this is lighter than this. Inability to determine shape. This is A stereognosis. A للنفي هون. A للنفي A stereognosis. N judge the texture لكلياته A stereognosis, the texture or forms. Somatic area located behind حكينا somatic area 2. Behind it, there is an area called association areas. Association, we will discuss the association areas in the last part of our lectures, but their function is to give a three-dimensional, 3Ds. 3Ds, that's function of the association area. We will discuss it at the end of this lecture. If this area is destroyed, that person will be unable to form a shape of this an object. لأنه shape of an object بدك 3Ds. We will discuss it in the later. Thalamus is able to discriminate tactile sensation ممكن, but mostly is pain and temperature, because pain and temperature, especially pain, very little fiber reaches the cerebral cortex. Most of the fiber, they end at the thalamus. So the thalamus is very important area for perception of pain. So if there is destruction of the sensory cortex, still that person can perceive pain, but not fine touch, fine pressure, but pain and temperature at the level of the thalamus. Very little tactile sensation at the thalamus. Very little, but mostly pain and temperature. Now from the cortex, some fibers, they go back to this receptor. from the cortex here back to the sensory system, receptor or sensory afferents. This is called feedback. These fibers, we call it corticofugal fibers. So this is feedback fiber or corticofugal fibers. From the cortex to the sensory relay, for what? To go and feedback, to have inhibition, suppress the sensory ممكن عشان adaptation ما يصيرش عنا، أو for other things to have good degree of contrast, sharpness of the impulse, to sharpen the degree of contrast or increase the sensitivity of the system. So this is feedback system. Feedback, corticofugal fibers. Most important for sharpness and increase in the sensitivity. Sharpness, like lateral inhibition. This is how the system codes, if you remember from the year 1, how the system codes for intensity. If the signal is weak, this is signal bond still. If the signal is weak, it will be able to stimulate the central one here. So these are the number of fibers that are stimulated if the signal is weak. If these fibers are stimulated, that person will explain it as weak stimulus. بقول لك هاي خفيفة. Now if this stimulus is strong شوي, بصير able to stimulate these areas here. This areas will stimulate just the middle one, and this area the middle one بصير عندنا هدول. This is strong stimulus, Charlotte. If it is very strong, it will be able to stimulate this all through here and on. So more fibers will be stimulated. So the intensity of the stimulus is coded for by two things: number of impulses and number of fibers stimulated. This is how we differentiate different intensities. The same thing here for, say, 2 points discrimination, high 1 point, high 1 point. This 1 point stimulates the central one here, and this 1 point stimulates the central one here. What happens here? We have lateral inhibition. This inhibits laterally here and inhibits laterally here, and this point inhibits lateral and this inhibits lateral. What happens in the middle here? We have no stimulus. We have no stimulus here. تغير بالسلايد ولا شايفين السلايد؟ الو؟ ماشي، شكرا. لانه ضرب عندي شغلات مش عارف شو اللي ضرب. طيب اذا هون والتسجيل ماشي نفس الشيء، ما وقفناش تسجيل. So no stimulus in the وبصير stimulus هون وstimulus هون، فعشان هيك we differentiate them as 2 bonds، لانه هاي البوند stimulus، هاي البوند stimulus. In the middle there is no stimulus. This is how you can differentiate these 2 bonds as 2 mirrors. لازم يكون في lateral inhibition. كمان اللاترال inhibition is good for sharpness. أخذناه بسنة أولى. This is كمان أخذناه هون بالسنة أولى stimulus strength. كل ما زاد السترينث بزيد إيش؟ بزيد ال interpreted stimulus strength كمان. بزيد ال number of impulses. Impulses بتزيد. This is how we differentiate different positions. steer اللي هو proprioception. شوف proprioception. كيف بدي افرق؟ هو البروبريوسبشن بيعتمد على ايش؟ proprioception depends on joint angulation. نفترض whatever joints هون، any joint. احنا خلينا كمان ما تضلش غير هاي بنخلصها. any joint فرضا عملنا extension مع مديت ايدك هيك. بنلاحظ انه في some neurons مثلا هون مرسومين 5 neurons. When you go into extension here, neuron 5 and neuron 4, their level of impulses is increasing. بزيد. And the level of impulses in neuron 1, 2, 3 is decreasing. لما يكون 1, 2, 3 are decreasing and 4, 5 are increasing. هذا الكومبينيشن اطلع على اي كومبينيشن بدك اياه لاي ديجري. مثلا 140 degree، هاي 140 degree، هاي 140 degree. This is the impulse rate at 4. This is the impulse rate at 5. This is the impulse rate at 1. ما في impulse rate في 4 whatever. This is just explanation. بتقول والله هاي حالة extension بتغير البوزيشن. طيب لو فرضا كان بالحالة الثانية flexion مثلا بيمشي بهذا الاتجاه، بهذا الاتجاه بتلاحظ 1 2 and 3 their level of impulses is increasing and 4 and 5 their level of impulses is decreasing. يعني لو اجينا لهون 120 degree بدل هناك، شوف ولا 120 degree قديش هون، قديش على 4، قديش على 5، قديش على 2، قديش على 4 وهدول. فلو تيجي مثلا 100 degrees 100 degrees لا 100 degrees فيش غير 1 2 3 and 4. فthis combination هذا التركيبة ما بتزبط إلا على 1 degree. يعني any degree، يعني هاي 100، هاي 120 different degrees different combination، هاي 160 different combination. فby this combination of impulses that comes from different neurons we know the position, we know our position. And this is important to understand it because when we come to the heat, when we come to the temperature, it has the same principle. That's all what we need today. بدناش نطول عليكم أكتر من هيك. ماشي؟ أي سؤال؟ Any question? Any question? حمزة يزيدك عافية. حمزة.
نعم دكتور.
حمزة.
معك
متسحر ولا مش متسحر؟
لا متسحر دكتور.
الحمد لله. صايم؟
صايم طبعا دكتور.
طيب نوقف التسجيل، بلاش اقول هلا بسألهم صايم ولا مش صايم بعدين كل واحد. ايمان نايمة ولا مش نايمة؟